Do you want to become rich investing in dividends? Stay tuned and I will show you how. This video will demonstrate how dividends can seriously make you wealthy, specifically companies which develop a sustainable competitive advantage and develop a huge market share because of it. This is what most dividend growth investors want to achieve, to live off the dividends in the future. This channel helps with this by analysing the numbers of a company being studied and then reviews that company's competitive advantage. Today we'll be reviewing Ramsay Healthcare. We will now begin the screening process for Ramsay Healthcare. Firstly, log on to Guru Focus and click on All-in-One Screener. Note, to follow along, you will need to have a paid subscription to the Oceanic region. Once in the All-in-One Screener, click on the Dividends tab. Now we will screen for companies that have increased their dividends 10 years in a row or more. In the next slide, we will show you all the available choices. Now select Ramsay Healthcare, ticker symbol ASX:RHC. Once there, we go to 30-year financials. The 30-year financials is where I'm getting the data for dividends per share. I will show which years I model when I go into Microsoft Excel. I will now find the average growth for the period I'm measuring. Here is the average growth rate for Ramsay Healthcare between the period of 2004 to 2014. As you can see, Ramsay Healthcare's dividend growth rate is very impressive. It just demonstrates what rapidly gaining market share does for a business in terms of compounding. I've entered the growth rate and I've assumed inflation will be 5% throughout the period. Here is the result. As you can see, the results are truly astounding. With just $2,000, your investment becomes over $163,000 in a 10-year period. And this only includes the growth from dividend cash flow. It does not include growth in the asset price over that period. Now let's discuss Ramsay Healthcare's competitive advantage. Ramsay Healthcare has been in operation since 1964. It creates barriers to entry by having a greater economies of scale than its competitors. A competitor would have to spend billions of dollars to compete with Ramsay Healthcare because if they didn't, their profit margins per patient would be negative. A competitor would need thousands of beds to make their healthcare cost effective. In addition, they would need to have a high quality of treatment. Another feature of this industry is the high level of regulation. This will require a firm to first be compliant, then it can operate. In the majority of cases, it takes longer than a year before a patient can even be seen. During this time, the business is just losing money. This is a huge disadvantage as it gives Ramsay Healthcare plenty of time to counter the new business's strategy and thwart their attempts to gain market share. Competition among the private hospital industry was average at the beginning of the dividend growth period measured. Ramsay Healthcare saw what few firms did at the time, that the private hospital and healthcare sector was ripe for consolidation. This is essentially what Ramsay Healthcare did. The strategy initially was to focus on delivering psychiatric hospitals to regional areas. The limited amount of people would greatly reduce the return on invested capital for other competitors. This is because, as explained previously, billions of dollars is needed to compete with Ramsay Healthcare. The consequence of this is that taking market share would result in the competitor being unprofitable. This is because a competitor would need to match the quality of Ramsay Healthcare. A hospital is already an unpleasant experience. Being the cheaper provider is not an option, especially in dealing with psychiatric care. You either do it well or you don't compete. This fact allowed Ramsay Healthcare in 1997 to obtain an 80% market share in private psychiatric hospitals in Australia. Once this aspect of their business was successful, they began focusing on gaining deal flow from insurers. To be a main health provider for insurers' clients, they decided to buy hospitals in suburbs where people were able to afford healthcare insurance. Ramsay Healthcare realised early on that most people only travel to hospitals near where they live. This means that buying hospitals in these locations allowed them to consolidate market share in the acute sector as a whole because people rarely switch hospitals. As Ramsay Healthcare got bigger in size, insurers had fewer choices in terms of other hospitals. This is because the majority of people that were able to afford healthcare insurance go to Ramsay Healthcare hospitals. After Ramsay Healthcare realised this, they adopted the negotiation practice of one in, all in, meaning Ramsay patients are only able to get healthcare rebates from one insurer. This in turn allowed Ramsay Healthcare to negotiate higher fees across all their hospitals. This video demonstrates that to earn the big returns in dividend growth investing, the investor must 1. Pick a fragmented industry, and 2. Buy a company that is using competitive strategy to consolidate market share. In this case study, Ramsay Healthcare consolidated market share by understanding consumer behaviour. Specifically, that consumer of healthcare, for the most part, wanted their healthcare to be local. This is because clients and patients seldom switch hospitals where they are close to where they live. The consequence of that practice by Ramsay Healthcare was that consolidation was able to be maintained in spite of other competitors in the industry. The nature of acute care meant that cost-cutting was not a viable competitive strategy. This effectively allowed Ramsay Healthcare to build a stable base from which to expand later for acquiring rural hospitals where they effectively had a natural monopoly-like status. If you enjoyed the video, please like and subscribe for future content.